Should you take a private student loan for dental school if you're still a dental student? This is a pretty loaded question, and it's something that could really help out cut your interest growth during school, but you want to make sure that you don't reach for a lower interest rate and give up the potential forgiveness benefits of having federal student loans. Here's a few things to consider. If you're going to take out a private student loan for dental school, then you need to have less than $300,000 of expected debt when you graduate. That's very important. If you're going to have more than that, it's extremely unlikely that you're going to be paying back your dental loan in full and not using forgiveness benefits, just because the government math is going to make it such that you're not going to want to have private debt when you could have a larger balance forgiven that you could pay income taxes on instead. The one product that just released is Common Bond's Dental Private Loan. You can take this loan out if you're in any one of the 66 dental schools in the country, and you can borrow up to $500,000. I would not borrow anywhere close to $500,000 because having a private loan is not as flexible as having a federal student loan. Now, this is a good product for people who max out their Stafford loans and want to have an additional $10,000 to $30,000 that they need to borrow so that they can cover the cost of their school, right? Because that additional borrowing would come from something called the Grad Plus program. So you'd have to take out a Grad Plus loan, which would be a 4.25% origination fee plus 7.6% interest. So compare that to the Common Bond Dental loan, that's a 2% origination fee with a mid-5 to high 6% type of interest rate. So the cost is certainly less in pure interest with a Common Bond Dental loan versus a Grad Plus loan. The main obstacle, though, is if your debt-to-income ratio is going to be more than 2 to 1, then going for loan forgiveness is probably going to make the most sense. So if you go to one of the 66 dental schools that's in the bottom third or bottom half of the cost distribution, or maybe you have parents or grandparents who are trying to help out with the cost of your school, and you expect to take out a relatively modest amount of debt, then the Common Bond Dental loan can actually make some sense. I would just want people to be very cautious about taking it out because it is not nearly as generous as the federal programs in terms of the repayment options. And then, of course, you cannot get any private loan that you take out forgiven, which is a really important thing. So just to recap, if you have less than $300,000 of expected dental school debt, you can check out the link in the comments in my article, and you'll be able to apply and see if you could get a private loan for dental school in your own name and not with a cosigner. And then if that's you, if you want to use it to borrow up to maybe $100,000 to keep your interest rate lower and not have to take out a Grad Plus loan, I think that that could help out some people out there. Hopefully Common Bond will expand this product to residents in dental programs as well, of course, because you have to borrow in these resident programs often with Grad Plus debt. And finally, if there ever becomes a cap on federal student loan borrowing for dentists, then this product would be even more valuable. So check out Common Bond's dental school loan. Be cautious with what you borrow, especially if you're going to owe over $300,000 or you're going to have a debt-to-income ratio above 2 to 1. And hopefully, in some cases, it can save you money on your interest.